Hi, Mrs. Brown here. I'm continuing with the Unit 12-13 review, and I want to talk a little bit about therapy and methods of therapy. So I've been throwing around the term psychotherapy a lot in the first video I did. So when we talk about psychotherapy, it just means that we're using a variety of techniques, psychological techniques to assist someone who's having an issue or a problem. So all of the different perspectives, sociocultural, psychoanalytic, cognitive, humanistic, behavioral, etc., are all within this psychotherapy category. What's different is biological therapy. And that's kind of its own category. So psychotherapy includes all of those other fields of psychology. And when we say eclectic therapy, eclectic means we're using a variety of different approaches, different therapeutic approaches, and different psychological theories. So if we're going to take someone who's coming in and needs therapy, and we want to use methods from all of the different schools or approaches of psychology, then that's called eclectic therapy. That's also psychotherapy. So we just want to remember what these mean. The first branch of psychology we want to talk about is psychoanalytic psychology and the methods that go with psychoanalysis. So these are mostly the ideas of Freud, Sigmund Freud. Remember, he stressed childhood experiences, that iceberg theory, and the conflict that goes on where your ego has to balance between your superego and your unconscious desires. Some of the methods within psychoanalysis are transference, so taking your feelings about something and kind of putting that on your therapist. Also using defense mechanisms and recognizing some of those defense mechanisms. Are you being defensive, quote unquote, or are you using things like sublimation, reaction formation, denial, and some of those other defense mechanisms we've talked about. Free association is another psychoanalytic technique where you kind of just say whatever comes to mind, whatever comes out. It's almost like a stream of consciousness kind of thing, or you might be shown different images and you just kind of say whatever comes to mind. That's supposed to reveal any unconscious thoughts or desires. And then we can use some of those projective tests, the Rorschach ink blot or the TAT, thematic apperception test. We can use those as well. Cognitive methods of therapy, and sometimes you'll hear them called social cognitive methods or just cognitive methods. This is about changing the way you think in order to influence your feelings and your behaviors. So changing your thoughts and your ideas. A lot of us have these self-blaming attributions that we need to look at our thought processes and recognize any illogical thought processes. And so Aaron Beck and Beck's cognitive therapy is basically using questioning, and this is very confrontational at times, but using questioning to reveal irrational thought processes. Albert Ellis also used REBT to look at your rational thoughts and your behaviors and how all of that was connected. So if you're looking at the way you're thinking about things, you should think automatically, oh, this is a cognitive method of therapy. Humanistic therapy, remember we talked about Abraham Maslow and also Rogers as our two influential humanists. So for Rogers, he really talked about client-centered therapy and making the patient into a client, someone who, is a human, has feelings, and those feelings deserve to be acknowledged and recognized. So one technique for humanistic or client-centered therapy is called UPR, unconditional positive regard, creating a caring and non-judgmental atmosphere using techniques such as active listening, where you're kind of repeating back what they are saying to show them that you're hearing them and understanding them, and also just using a lot of empathy, making them feel understood and supported. And so the whole idea behind this is to promote personal growth and self-fulfillment. And this feeds in with Maslow's idea of his hierarchy of needs as you're trying to meet your needs and move towards self-actualization, self-transcendence as well. Another method of therapy is the behavioral school. So again, this is trying to change maladaptive or bad behaviors. So it's not concerned about the way that you feel or the way that you think, as some of the other schools are. It's more concerned about how can we change the behaviors, not the thoughts or the personality or anything like that. So it applies the principles of learning. And remember, we talked about three big influential people. We talked about Ivan Pavlov and classical conditioning. We talked about Watson and operant conditioning. And we talked about Bandura and modeling, or the social learning theory. So it takes some of those ideas and it helps to change behavior. So with operant conditioning, one thing we can use is a token economy for therapy. So rewarding behavior and promising rewards that can be exchanged, things that didn't have value that can be exchanged for things of value as someone makes progress toward desired behavior. We can also use classical conditioning methods such as counter conditioning to change bad behaviors, and aversive conditioning, where we're kind of either rewarding, if we're using counter conditioning, we're rewarding the behavior as we're trying to condition them, towards naturally doing something. Aversive conditioning is also another technique we can use. Conditioning is basically using something unpleasant or as a punishment to stop an unwanted behavior. So this would cause a strong feeling of dislike or disgust when an undesirable behavior is presented in order to try to reduce or eliminate that behavior. We can also use exposure therapy. This is probably one that's used more frequently, especially with panic disorders or specific phobias. So we can use exposure therapy, especially systematic desensitization. So this is when you systematically expose someone to what they're afraid of or what they're trying to deal with in order to get them over that fear. So first you have them think about that particular thing, and then you have them encounter it, and then you walk them through getting through that particular situation and give them the scaffolding or the guidance they need to systematically desensitize themselves so that they're not as afraid, so that they don't fear the unknown or what happens whenever they face that situation. So those are some methods of behavioral. Insight therapy is the idea that you're going to increase the patient's awareness of their own motives and defenses. So part of this is cognitive, part of this could be psychoanalytic, exposing unconscious desires. But anytime you're just increasing awareness of their motives and their defenses and what they're doing, that could be unhealthy, you're using insight therapy. Biological therapy. I touched on some of this in the first video, but there are all kinds of biological therapies out there. Biological therapy is a separate category separate from psychotherapy. So the first and probably the most obvious form of biological therapy is drug therapy. Okay. There are lots of different drugs out there to help. So we call this psychopharmacology. Psychopharmacology is using drugs to treat the mind and behaviors. So we have mood stabilizers such as lithium to treat bipolar disorder. We have anti-anxiety meds like Xanax that help to treat anxiety and depress central nervous system activity. We have antipsychotic medications like Thorazine that treat schizophrenia. We have SSRIs, selective serotonin reuptake inhibitors like Prozac that help treat depression. And there are lots of other drugs. We have stimulants that we use, Ritalin and Adderall, for example, for ADHD. So there are lots of different drugs out there. And psychopharmacology is just one method in biological therapy. RTMS is repetitive transcranial magnetic stimulation. We use RTMS to treat depression. ECT, electroconvulsive therapy, and shock therapy are not used as much today, but they are used for severe cases of depression and schizophrenia. And psychosurgery as well. We don't really use this very much today anymore. They used to use it a lot more, like in the 1950s, using psychosurgery in performing lobotomies. But that still is biological therapy. So these are most of the methods, and you should just make sure that you understand not only what the methods are, but what field or school of psychology they fall under and how they can be used to treat each of the disorders. So if you have a disorder, you should also know how to treat that disorder. What are some options out there? And a lot of times it's a combination. Okay, this is why the field of psychiatry exists. It's a combination of medical treatment, following that medical model, and the psychotherapy as well. So you can't just have one or the other. You're going to have both. You're going to have both the psychotherapy, the psychology side of things, and the medical model, the biological or the drug therapy, in order to make sure that the person is getting very well-rounded treatment. Okay, so yeah, that's it for our review session. So happy studying.